All right, guys, Dr. Lera here. So I have a client that's here today, and the patient's name is Penny. That was a little kitty cat that you saw. I don't know if you were able to hear it, but she made that little meow sound. The topic for today is having to do with when you board your cat. When people board their cats, sometimes they'll come back and they have like a snotty nose, cough, decreased appetite, sneezing, an eye infection, something like that. Those are similar symptoms or symptoms that usually we most commonly associate with upper respiratory infection in cats. This is a topic that I have to discuss about the past, but I wanted to go ahead and just kind of do a refresher on it in regards to if you take your cat to be boarded and your cat has ever had some sort of runny nose or any of those symptoms in the past, and you end up going ahead and taking your cat boarding, then a day or a few days later after you take the cat boarding, the cat ends up having some of these symptoms, it's more than likely not that your cat got something at that place. It's more that your cat probably already had something, and now the cat is actually having to deal with the stress that they received when they went ahead and went to the boarding facility, and then they were allowed to have that herpes virus come back up and awakened due to the stress. Herpes virus, I don't think I said it before, but that is the primary instigator, let's say, or agitator or cause of these upper respiratory symptoms. And it's something that a very high percentage of cats actually have at some point in their life. And what I equate it to in humans is like when people get fever blisters or canker sores or whatever, and it's something where it's brought on primarily by stress. I don't have really a horse or a cat in this game, let's say, because I don't board cats, so it doesn't really matter to me. I just want people to be informed about if your cat gets something or gets sick after boarding, there's a pretty good chance that especially if they're in a cage, it's not from the boarding facility. It's probably because your cat already had that thing and it was the stress of going to that facility that probably brought that out. Now, if you take your cat to one of these places that's like a cattery and they're allowed to go ahead and interact with other cats and all those kinds of things, now there's definitely an increased risk of having something transmitted by one of those other cats. But otherwise, that's usually not the case. Few and far between is it that your cat's actually allowed to interact with other cats. It's more so that they're in a cage. So I hope you guys found this video helpful. Thanks for watching and have a blessed day.